Hi, I'm Dr. Cindy Mitchell, and I'm here today to discuss the MonaLisa Touch with you. If you have any questions, please feel free to put them in the chat. So what is MonaLisa Touch? It is laser therapy for vaginal health restoration. So why do we even bring this up? Why is this an issue? Currently in the United States, there are about 46 million women who are in the menopausal age range and about 2.8 million women who are breast cancer survivors. Given that these are large numbers of women, it's surprising that only about a quarter of these women talk to their physicians about symptoms that they may have. So the types of symptoms that the MonaLisa Touch can help address would be vaginal dryness, itching, pain with intercourse, a burning sensation. Also, actually not on this slide, is an increase in bladder infections and vaginal infections. So why does this happen? As women become menopausal, they lose estrogen. And when you lose estrogen, you end up with changes in the tissues that cause all the symptoms, the vaginal dryness, itching and burning, and the pain with intercourse. And so a lot of women just think that this is a normal aging process, or they may be embarrassed to bring it up with their provider, and so they don't. And then for the women who do bring up their symptoms, the typical option that they're given is either hormone replacement therapy or vaginal estrogen, either in the form of cream or a pill, which isn't necessarily for everyone. So, for instance, there are some women with breast cancer who've been told that they can't use estrogen, or you have some women who have tried the either hormone replacement therapy or the estrogen preparations, and for whatever reason just don't tolerate them. So the MonaLisa Touch is a fantastic option that we have to offer our menopausal patients who don't do well with hormones specifically. It's a quick procedure, lasts less than 5 minutes. There's virtually no discomfort and no downtime. So what happens during the treatment? During the procedure, you're placed in a position similar to when you're having your annual exam, your pap smear, and we will insert the laser into the vagina and deliver laser energy pulses in a circumferential manner. So we're getting the entire circumference of the vagina along its entire depth. The whole procedure typically takes less than 5 minutes. So this is a great slide that shows what the vaginal tissues look like before treatment and then 2 months after treatment. So just to clarify, the slide that shows the vaginal tissues after the treatment, that vagina basically looks like the vagina that was before you had any of the hormonal changes. So it basically restores the vagina back to premenopausal health. So under the before treatment, you can see how that top layer of the vagina is very thin. And then after the treatment, you get that thicker top layer, which will translate into more moisture. What the laser does is it delivers the laser energy to the very superficial parts of the tissue underneath that top layer. And what it does is it causes some thermal damage. It heats it up. And what happens when you damage the tissue like that is the body's natural response is to try to heal that. So in so doing, it brings in new blood vessels to the area, water, collagen, and elastin, which basically helps to build that support material, which will bring the vagina back to the plush, thick tissues and the tissues that are elastic. So for instance, women who have been through menopause and try to make sex more comfortable by using lubricating jelly, they notice that the sex is still uncomfortable. Why? Because even though you're taking care of the moisture problem, you haven't addressed the fact that the tissues are now thin instead of plush, and that they're no longer stretching, they're no longer elastic. Does the treatment hurt? The laser energy is pretty much painless. as you come closer to the outside of the vagina, if anyone has had hair laser removal, they'd be familiar with the kind of rubber band snapping sensation, but that's only towards the end as you get closer to the outside. During the first treatment, and we haven't discussed this yet, but it's basically a series of 3 treatments, but with the first treatment, that may be the most uncomfortable one because the vagina is so dry, and so sometimes getting the laser, comfortably situated in the vagina may be a little difficult. Not too bad. I mean, we go very slowly and we're very careful, but then the patient's comfort does improve after we've done that first, second, and then the third treatment. Again, it's a very simple, fast procedure. There are 3 treatments given at 6-week intervals. Again, the procedure lasts less than 5 minutes, and then after those 3 treatments, we just do like a yearly maintenance. Have there been studies that show that this works? Yes, clinically proven. There are studies that show immediate relief after the first treatment with some patients, but definitely after the second and third treatments, you should notice much more relief. And we've had thousands of patients successfully treated since 2012, and clinically, I've seen it. This is a graph of the percentage of improvements in the various symptoms that women complain of: the burning, itching, dryness, dyspareunia, which is pain with intercourse. I think personally, clinically, I've definitely seen higher than 72-76% improvement in the dryness and pain with intercourse categories. Laxity, that just means pelvic relaxation. Again, when you lose your hormones, you don't have as much of that supporting structure, and so you might notice that you might be a little incontinent. You might have some urinary incontinence. That can be part of that. So actually, that's something we haven't talked about either, but the MonaLisa touch, I think, can also help with that mild urinary incontinence, again, because it's bringing in more collagen and elastin to the tissues that are around the vagina and really around the urethra too, to support the urethra. These are the options. If you look at the prices for the options, monthly prices of the Premarin preparations, either through a cream, Vagifem, which is a pill, Estrin, which is a device that goes in the vagina that secretes estrogen continuously. And then Osphena is an oral prescription, actually. So you see that you're paying with the prescription medications, you're paying anywhere between $134 to almost $300 per month, especially if your copay doesn't cover that entirely. Again, this is just a rehash. It's a quick in-office procedure, 3 treatments of less than 5 minutes each, no anesthesia required, and it has been proven to have results. So with that, I will take any questions. If there are any questions, please type them into the chat.